They were taught in dental school to make a night guard, basically a horseshoe thing that went over the surfaces of the teeth to protect the teeth, but did nothing for the treatment of TMD, although the claims to this very day are out there routinely that night guards treat TMJ problems, which they don't. They protect the teeth. They don't treat TMJ problems, and more often than not make the problem worse. They just give the patient something to chew on, or they do nothing and don't want anything to do with TMJ. We know the general dentists don't know what to do. And then there are the very few TMD gurus now who call themselves specialists in TMD, TMJ problems, who use smoke and mirrors and voodoo, machinery, all kinds of various types of machinations to treat at very best symptoms. And there's very little value in treating symptoms. And I have to include, and I've talked on it specifically, the newest deviation from reasonable treatment, which is Botox, which is nothing more than paralyzing certain muscles of the face, which need to be repeated every 3 or 4 months, and isn't any better than injecting saline, which has been proven by scientific article. And they call themselves specialists. Well, I'm not out to berate or criticize or delimit any of them. It's just the fact that I recognize that's what's going on. And anyone who has this problem, I think, for any length of time, also recognizes this problem because I see them in our practice daily.